Thanks, Sandy. Good morning, members, and welcome to this meeting of the Social Work Services Committee. The meeting has been live streamed and will be made available on the Council website for public viewing. Could I remind members to follow the good practice guidance, which includes muting microphones and switching off your video when you're not addressing the meeting. Should you wish to contribute to any item, you should write "Speak" in the Teams chat function, and you will be invited to speak in order about new issues. Should your question or issue be raised by a previous speaker, please withdraw your request so that we deal with the business as efficiently as possible. The usual standing orders apply, including that any votes will be undertaken by roll call. If any member has to leave the meeting for any reason, can I remind you to either leave the Teams meeting for that period of time, or you could write "leave" in the Teams chat function and then join. This will allow us to monitor member presence. Clerk, can you confirm the sender and I'll then who's remote? Thank you.
Okay, thank you, Chair. I've got one apology this morning from Councillor Mayo. There's a number of members present in the hall, as well as yourself, Chair. We've got the Vice Chair, Councillors Jameson, Johnston, McFarlane, Scobie, Slater and Wilson, all in the hall. All of the members present on Teams, apart from currently Councillor Karen Crothers, not present.
The message we had for Councillor Mail was he would hope to join us later, depending what time his meeting at 10 o'clock in Langham was over. So mark him down as absent just now, but he could very well join us later on, Clerk. Thank you. And obviously I approve remote participation of members. Can I ask members, are there any declarations of interest?
I'll just say for clarity, Councillor Karen Crothers has just joined the meeting on Teams.
Okay, thank you very much.
Folks are saying they can't hear. There's a number of people online.
People are saying they can't hear. I'll get the tech team to check that, and we'll just take.
Is it specifically Claire? Is it really quiet when you speak, Claire, or is it everybody?
Oh, it's okay. We'll just move the mic closer to Claire in that case then. Can you give us a wee test, Claire?
Okay, thank you, Chair. Can everybody hear me now?
Yes.
Yeah, okay. Yeah, see, I've got a yes there from on the chat.
Yeah, it's on.
Thank you very much. Any declarations of interest? Okay, thanks. So I'm getting ready to move to the business here. Item number 3 is the minute of the previous meeting for approval. Are we happy to approve? Yeah, I'm not seeing anybody to the contrary, so we'll take that as a positive. We'll move on to item number 4, which is the Revenue Budget Monitoring Report for the period up to the 31st of December. Janet Sutton, our Finance Officer, is with us. The service has experienced some pressures in 3 areas: direct payments, fostering and kinship care. Senior team are aware and are working towards addressing these pressures. That's my introduction finished. Janet, is there anything you'd like to add to this, or are you just happy for questions?
I'm happy for questions, Chair.
Thank you very much, Janet. So, questions? And Andy Mack.
Yeah, thank you, Chair. Paragraph 3.7 says that we anticipated we're going to have an underspend, but all of a sudden we're going to have an overspend. And it says that a recent increase in both the demand and cost of children's residential placements. Can we understand what it is that's actually caused that? Is it the demand, or is it the cost, or is it a combination of both? If we perhaps have some context in that'd be helpful. Thanks.
I'll get the Chief Social Work Officer to answer that instead of Janet. Thank you.
Thank you, Councillor McFarlane. It is a combination of both. We have had a significant increase in referrals for children's services and consequently a significant increase in the requirement for us to find agency placements. Across the whole of Scotland just now, there is a shortage of placements. and consequently providers have got an open market to kind of increase their costs and their charges. So we do find ourselves in a position where you've got 3 or 4 local authorities chasing one placement for a youngster. Members are aware that we try to keep our young people in region as much as possible, but unfortunately there are times where the support that's required for that particular young person is not available. So we will go external for that placement, and we have found increased costs around those young people from the providers. The other aspect is that we've got some extremely damaged young people who present with challenging behaviour that requires us to increase the support. So for some young people, we currently have a young man who is requiring 4-to-1 support due to having an extremely complex range of challenges. So there is undoubtedly a coming together of many of those factors that have caused us to be in this current position. Thank you.
Yeah, thank you for that. Is there any regulation on providers to sort of manage their fees, or is it just an open market? Thanks.
Again, thank you for that question. There is regulation under Scotland XL, the contractual arrangements for providers. However, where there is the additionality, so if we have to increase staff levels or we have to have a young person there for a longer period of time, then the providers then can set that particular tariff at that particular point. So it's very bespoke, and as I say, unfortunately at this moment in time we have a number of youngsters that are causing some real challenges in caring for them. Thank you.
Okay, Andy, yeah, thank you. Willie, did you want to speak? No, so thanks. I can't see anybody else, to be honest. Nobody in the room, certainly nobody in the... There's a hand going up. Can you... Linda, can you use the talk thing, because I can't see the hands because they're just showing that it'd be a lot easier for me if you could oblige me. But that's is it Linda Dorward to come in?
Thanks, Andy. Or thanks, Chair. Sorry, noted. Being a bit informal there. Cheers, Chair. I'll do that in future. It's point 3.4 on page 13, direct payments, and that's noted as one of the areas that there's a pressure on budgets. Just a question in terms of this. It says that people are moving to more to source their own care rather than using more traditional building-based services. Why is that? And are they assisted to do that with social work assistants? Are they advised or assisted to do that? And in terms of meeting the needs of the child or GIRFEC, is that being managed well? If that makes sense. Thank you.
Thank you, Councillor Dorwood. This is done in conjunction with a social work assessment. So under self-directed services, we always engage with the families and the young people themselves to make sure that they're aware of the options available. There has been, as you'll be aware, throughout the COVID pandemic in particular, a reduction in what you would class as traditional services, so i.e. respite, particularly for some of our young people with disabilities. So families have chosen to look for their own care packages. That will be done in conjunction with a social work assessment and risk assessment, and then the SDS budget will be awarded to assist that family to purchase the care. It is an area that we would always look towards families and young people to have that choice. Again, a bespoke package that would meet their needs. It does tend to be more difficult in the wide-ranging variations of our region to get those particular care packages in all parts of the region, and consequently the need for the hybrid of the traditional delivery of care along with the individualised packages is something that we continue to work towards getting correctly in balance. Thank you.
You okay with that, Linda?
And just come back for a minute, Chair. So thank you, Lillian, for that comprehensive response. It almost sounds like what we're trying to do is the right thing, but we don't maybe have enough service provision to make that happen. And is that something Sorry, another question. Is that something that's evident across the whole of the country as well as Dumfries and Galloway? Thank you. That'll be me. I'll shut up now. Thanks.
Thank you, Councillor Dorwood. The short answer is yes, but obviously in the kind of central belt regions then it is much easier for example, to get personal carers, to get personal assistants. However, we're working towards having different processes for accessing services under the SDS legislation. We also used to have some fairly big organisations that worked alongside individual families to help them with the tax, holidays, etc. for those that they employ to provide those personalisation packages. Some of those, unfortunately, throughout COVID have no longer ceased to exist. So that's an area in the market that we're having to offer some additional support to ensure that families are covering their legal obligations by choosing an SDS package under the legislation. So hopefully that answers your question. Thank you.
Okay with that, Linda?
Yes, thanks, Chair.
Okay, thank you. Just for clarity, I'm assuming the Central Belt, it's not because they're better at it than us, it's because if it's a bigger workforce pool. Am I right?
Absolutely. It's just I'm confirming that they've got more access to different services. Thank you.
Yeah,
Sorry.
that's what I thought. I would hate the people down here to think. No, a problem. And I've got another question from John Young, please.
Thanks, Chair. Very interesting. I previously worked at Gogarburn Hospital with children with extreme behavioural problems, and I'm finding it quite difficult to get my head round a 4-to-1 care situation. It must be pretty extreme, but that's just an observation. My question is, yes, these particular care packages involve very high costs. Are these costs shared with the Education Department?
Thanks, Councillor Young. On some occasions they are. If there's an education element, then yeah, there is a percentage attributed to education. It's not in all cases. So, if a young person's been excluded, there may be less of a percentage agreed with education colleagues. But we do work collectively to make sure that care package is met. Thank you.
Okay with that, John?
That's fine, Andrew. Thanks.
Thanks. Just before we move on to George Jimison, did the NHS ever contribute?
They may in a transitional case, so where a young person's transitioning into adult services.
Okay, thanks very much. That's just for clarity. George?
Yeah, my question, similar to John's actually, without any forward planning. The self-directed services, how inclusive is that with the schools, given that that these children need an education? It's obviously very challenging for a lot of these young folk to get into schools. And how closely do you work with, for example, the support for learning in the schools? Because again, it's a challenge for these learning assistants to work with these children, but again, it's really important for the families as well as the child to get that support in the school, and for the folk in the school to understand the challenges that these children have had.
Thanks, Councillor Jamieson. I mean, in terms of an SDS package, it will be for the care provision. But obviously, as a consequence of the social workers working with the young people and their families, then we will have had intensive engagement with education colleagues. Some of the challenges are when a youngster, the educational needs can't be met, and then they're placed perhaps in an agency placement out with the region. Then we do have some challenges having that placement, the education being part of that support package. But generally, we work reasonably well with our education colleagues to make sure that provision of education, if it's in region, is met. The SDS element will be for the provision of what would be classed as a social care. So only when a youngster goes into an agency placement would we then be looking for a contribution from our colleagues in education. On the first part of your question, we do engage all the time with the colleagues in education around the support that's required within the school, and that can vary.
Minutes, okay? It's at 11 o'clock, but it's 5 minutes, that with me, coming out. Okay.
Sorry, yeah, so I've lost my train of thought. We will work closely with education to make sure they're aware of some of the challenges for the youngsters within the school. And obviously we'll support in whichever way we can. Thank you.
No, that's just a wee follow-up. That's really good to hear. There's obviously increased. There's 30-odd% of young folk with identified assisted support needs. I would like to look further into how educators are there to educate and the social care and psychologists are there to help them with their... It's how we blend these together to get maximum impact. So I think it's something that you're aware of, and the promise is part of that. Resources are obviously fairly thin. It's just... My question is, can we do it better from all sides? That collaboration, can it be increased? I know everybody's stretched, but it's really important that children in school with the inclusive agenda, that they have that support for the school, because they're not psychologists and they're not care workers. But if we can get the children to a position where the educators can help them in any way, shape or form. So it's just to emphasise, which you already know, that collaboration is absolutely key, and it shouldn't be a victim to stretch resources.
Thanks, Councillor Jameson. Obviously, Stephen would normally be here. Stephen Morgan leads on this element of the agenda for social work services. Unfortunately, Stephen has COVID, so isn't able to attend today. But I can assure you that Stephen works closely with colleagues in education and will continue to do so and raise those issues. Thank you.
Okay, thanks. Paula?
Thank you, Chair. I was just wondering if there was any difference in the uptake of SDS1 between children, or SDS1 for children and SDS1 for adults. Thank you.
I don't have those figures to hand, but I can certainly get those for you and share them. It's a very different landscape in adult services and children's services, but we certainly make sure that we offer, where possible, that SDS option to both children and adults. But I'll certainly get those figures and share them around committee. Thank you.
Okay, thanks very much for that. You okay with that, Paula?
Yes, Chair, thank you. It would just be interesting to find out if there was a bit of a difference, and maybe if that would help in the uptake of SDS1 for whatever side is the lowest. Thank you.
Yeah, absolutely. And Lillian, there's a commitment. We'll get that information out to members. Just incidentally, before we move on, I'm assuming all members got the briefing notes and some of the explanatory stuff that came out on the back of your last committee. And I think it's the way forward. It's the way we should be doing it. And that keeps everybody up to speed, and we share it with all members, not just the committee. So that's good for me. Is there anybody else got any questions on basically what should be the finance paper? But I was happy to let that develop a wee bit. No more. In that case, then we'll move on to recommendations 2.1, and that's based on the Q3 monitoring. It's estimated social work will overspend by 415,000, as detailed in Appendix 1, by the end of the financial year. 2.2. We're asked to note that social work services may need to access the social work support fund if expenditure cannot be obtained within the available budget. And then 2.3, progress against the delivery of agreed policy development allocations applied to the 22-23 budget as detailed in Appendix 2. Just for information for new members, that social work support fund, how much is it roughly, Lillian, or have we had to use it up to date?
Thanks, Chair. To date, we haven't had to use it, and it can sit up to £1 million, but it is our contingency and support fund. Thank you.
Okay, so and that's mainstream budgeted, isn't it? So, so it looks as though we're coming back within budget, even if things continue the way they are. Is that a fair representation, Janet? Yeah.
Yes, Chair. Yes, Chair.
Thanks very much. So are we happy to note all these 2.1, 2.2 and 2.3? Okay, noted. Thank you very much. Janet, thanks for your time. We'll move on now to item number 5, the 6-month assessment of Social Work Services Business Plan. Gillian Grieveson's here to speak to this report. It's the 6-month assessment of performance against the business plan for 2019 to 2023. Notably, the local government benchmarking framework data is embargoed by the Improvement Service until March so it does not feature in this report. So as long as members are aware of that, maybe get Gillian or Lillian to explain better to members what that actually means, because we will be provided with that at the end of year report. Gillian, good morning. Is there anything you want to add to your report?
Good morning, Chair. No, nothing further to add. Just that point of clarity. The local government benchmarking framework data is embargoed by the Improvement Service until March. Therefore, we're not at liberty to produce it or print it. So that will be available to members at the end of year business plan report further in the year. Thank you.
Thanks for that clarity, Gillian. So I'm just going to open it up to members for scrutiny. Willie?
Thanks, Chair. I'm looking at 3.112.8. What continues to progress on the planned developments and actions for the next 12 months, including focusing on mapping of all family support activities available across Dumfries and Galloway.
Sorry, Councillor Scobie, I missed the beginning of it. What report are you on?
Let me start again.
Yes, please. Thank you.
Yeah, I'm referring to 3.12.8. I'm being asked to use two mics now. That's the item I'm looking at, Chair. Page 24. Right. Refers to progress in our planned development actions for the next 12 months, including focusing on mapping all families. My question is what is the current position with respite in the region, particularly west of the region, and whether it meets demand or needs rather than demand. And my next observation is on the exceptional reports. On page 48 refers to complaints, and I note that we have improved on a very low figure of 28% to 33%, with a target date of 80% to respond to complaints within the 21 days, and indeed what the SPSO says about complaints being completed within the 21 days. If we could have some clarity, how we're progressing on that one. And also on page 49, why you would report back to, not maybe why, I can understand reporting to other departments and committees, but this one says reports back to communities. Does that not mean social work? So it's three issues there, Chair.
Last first, communities have the brief in the council to monitor all the complaints and everything else through EMES. Now, all the other inquiry services, they all go through there. That's for my time as Chair, Willie. So that's the answer to that one. I'll let Lillian answer the social work questions.
Thanks, Councillor Scobie. I'll start with your first one on respite. Absolutely an ongoing challenge for us. It would be absolutely correct to ascertain that we don't have enough respite within the region, particularly for children and families. So we are doing a significant amount of work to look at the different models in which we currently deliver that level of respite required. We have not fully recovered from COVID in terms of, in terms of recommencing all the respite services. And as an IGB member, you will be aware that there's an ongoing review into respite within the region, which is just at the process of going back to report to the Integrated Joint Board. And we will await that outcome, because the respite provision is a joint provision. So I would absolutely agree that this is an ongoing challenge for us. We are looking at different ways in which to deliver respite, but many of the providers have not recommenced that service at this moment in time. In terms of your comments on page 48, what I would draw your attention to is that we actually had 3 complaints that went to stage 2. And this is what this value and reflection in terms of percentage relates to. We find ourselves often with a stage 2 complaint where we have to do a wider investigation. Sometimes we can't get the service user who's made the complaint to come back and talk to us again, so that can oftentimes be a delay. On these 2 particular cases, they were very complex complaints. We undertook the work to try and conclude them, but even when we have the agreed extension from the SPSO, which you will see in the report, the SPSO had agreed that we needed further time to complete these complaints, they're still counted as late. So it's a bit of a it's a very fine balance that we want to do the complaint justice and fully investigate it as members would expect us to do so. But by doing that and us seeking and receiving an extension, we are then penalised because it counts as a late report. So hopefully that gives you clarity. Thank you.
Okay, do you want back in, Willie?
Please, Chair. Just on, well, no, just, but on the respite issue, I'm not aware of it being reported back to IJB, but no doubt it will come there as a joint service. But we, you know, in a later report, we refer to foster and residential. If we can't provide that respite, some of these kids end up in foster or residential. So it's an issue that we need to focus our attention, whether it be jointly with NHS or whatever, but we do need to, because it means that kid being taken away a fair distance from their homes, particularly in the west of the region, where I've had experience of that. So I'd hope that we do concentrate on trying to recruit respite provision in the region. Just on what you're saying, I did note that there was 2 out of 3 complaints and we had gone from 28 to 33. I think we do need to look at that as well. If the stage 2 complaints are low, as they seem to imply, in terms of only 3 complaints, I think we do need to try and deliver on time, but accepting what you said in respect to the SPSO.
Thanks, Councillor Scobie. Yeah, the report is going to the IJB in March, so that will be further discussed on respite. And again, we are bound by the legislation of the complaints, but we always want to try and conclude them as quickly as possible, but equally we have to make sure that we gather the appropriate information to satisfy both the complainer and the SPSO. Thank you.
Okay, thanks. You okay with that, Willie? Yeah. I've got Pauline Drysdale and then Andrew Wood.
Morning, everybody. Morning, Lillian. And thanks very much for the report, Gillian. It was just a quick question with regards to Bernardo's. I'd noticed that we've got a tick in the box on page 29. And I'd noticed, Lillian and Gillian, that there was somebody being recruited in Dumfries for the Bernardo's unit. So I'm just wondering if you could give us a wee bit of information about how Bernardo's works with our social work department, if indeed anybody knows. I must be honest, I don't have much knowledge on that, but obviously there is tremendous support, I believe, across the rest of Scotland. So it was just to see how we were doing. And obviously this group might be helpful going forward if they've recruited somebody else. So yeah, just an update on that. Thanks very much, Chair.
Thanks, Councillor Drysdale. As you're aware, that for looked after and accommodated children, we have a responsibility to provide them with independent advocacy to make sure that their voice is heard. And the organisation that provide that advocacy service for Dumfries and Galloway for their looked after and accommodated children is Bernardo's. It's been a very long-term relationship. They've been an extremely effective partner in working with our most vulnerable youngsters that are looked after and accommodated, and we're absolutely committed to making sure that Bernardo's have a presence in Dumfries and Galloway to provide that service to our young people. Hopefully that gives you the clarity. Thank you.
That's brilliant. Thank you very much.
Thanks, Pauline. Andrew?
Thank you, Chair, and thank you, Lillian, for the report. Now, appreciating that this report is obviously a historical 6-month report, and looking to the future, I have had concerns raised by social workers regarding the proposed Scottish Government's new National Care Service, which is expected to be complete its substantive legislation process around March. If passed, the bill will enable services to be taken out of the democratic control of local authorities and placed in the hands of care boards, responsible only to ministers, further eroding councils' responsibilities. What is Social Work Services' plan for the proposed change in social care delivery? And furthermore, policy drivers, are we further forward in understanding what workforce implications will be in relation to the proposed establishment of the Scottish National Care Service, as detailed a year ago in the IGB Health and Social Care Workforce Report from a year ago? So could we possibly get those answers? And I'll come in with some further questions once we can get an understanding of where we are with that, because I do believe that we have to open up the conversation now.
I'll let Lillian come in. Yep.
Thanks, Councillor Wood. In terms of the National Care Service, it's still in consultation process at this moment in time. There is no further clarity from the time that we had the member seminar. We're still awaiting the final decisions around the process at which National Care Service will be introduced, and what will be in that National Care Service, and what will that mean for a local service delivery. It's fair to say that there's many areas of consultation, there's many areas of working groups going on, but at this moment in time it would be impossible for social work services to plan for the future on two fronts. We do not know what will be in the National Care Service. Will it be adults? Will it be adults, children, families? Will it be adults, children, families, justice and mental health? Those are the areas that are unclear at this moment in time and continue to be part of the ongoing consultation process. And the second part is we are unclear at this moment in time whether Dumfries and Galloway would have a care board that's standalone or whether it would be part of a wider regional service delivery. These are the national questions that are being posed before the legislation will be brought back to Parliament for a clear steer on what the NCS will look like moving forward. So we're having conversations, but we're unclear as to what planning would need to do at this point. Thank you.
Just before you come in, Andrew, 2 seconds. So we're still engaged, obviously, in some working groups?
Yeah, there's many staff involved in the working groups at this moment in time. Thank you.
Thanks very much. Andrew, you want to come back?
Thank you very much for allowing me to come back in, Chair. There are serious concerns, though, with regards to this changeover if it does take place, because my understanding is that TUPE will not apply and that pensions will be hit for those within the social workforce. So I'm very keen that if and where possible, Lillian can keep us updated at the earliest opportunity, because if we don't, we will end up with an unsettled workforce. We have difficulty recruiting social workers at present, and I certainly wouldn't like to see this being another stumbling block to getting this extra workforce. The other thing that I was going to ask, actually, it's on, I think it's page 34. Why is it only 43% of staff who have completed the annual performance development review, where our target is 95%, I think? And what has been done to make sure that staff who haven't had PDRs in the last year will get them? Because about 57% of staff have not received them, and I would suspect that this is an important part of staff development. Would that be correct?
Can I just answer your first point, Councillor Wood? Certainly when we have any more clarity on the National Care Service, I will call another seminar for elected members. So that is on the forward plan when we have more detail. In terms of the PDRs, I think I just need to really give clarity to members. We in social work do what is classed as professional supervision for all of our staff, and that will happen on a monthly basis. We have struggled over many years to meet the target for the PDRs. This is a wider document and a wider intervention around work that we need to do with staff to identify training and growth opportunities. We do that through the professional social work process of supervision, but I absolutely accept that we haven't met the target for PDRs. I've explained to members before that sometimes we set some time in the diary to do these, and then a protection issue will happen. And as members are aware, we're extremely thin on the ground with our qualified social workers just now. So what tends to happen is that time that was put aside to do a PDR doesn't happen because the worker or the senior or the manager then has to become involved in a protection element. So I certainly accept that this is an area that we need to try and do better on. But I do want to give members the assurance that in terms of the professional support and the training to social workers, that goes on another pathway. So we're certainly looking to see how we can do this better, but it has been an ongoing issue for us. We also have the issue in terms of the recording of the PDR, and sometimes that's around people having more than one job within social work services, and we need to get better at making sure we do that correctly. But again, unfortunately or not, but sometimes when other things take precedence, then these are the things unacceptable. I accept that, and I hold that responsibility on behalf of the service. Thank you.
Okay, Andrew.
Chair, just to come back in on that, and very much appreciate Lillian's frankness and honesty about the situation. My concern, and I put this to yourself as part of the administration, is that during Education Committee, this was also a problem, that staff development was not meeting the targets that it should have been meeting. And I hope that this council is not dropping its or lowering its standards on our staff development. So if you could possibly push that one forward and see if we can't get progress in that particular area, that would be extremely helpful, I think.
Okay, thanks, Andrew. Well, you can be assured that I do, and we do raise that with Lillian on a regular basis, the Vice Chair and I. But the one thing we can't do, Andrew, is create time. We don't have time and resources. The people aren't there to do it at times because, quite frankly, if they're given the choice between looking after a vulnerable child or doing their PDR, the staff themselves choose the child, right? No the managers. So whilst your concerns are there, Lillian's been very frank, right? It should be better, but we are where we are. And we can't just manufacture social workers or people to meet a target on something like that. I think for me, the really important part is the professional supervision is ongoing. And undoubtedly in that professional supervision, there will be elements of PDR discussed, right, but not formal PDRs as you would expect in an HR kind of environment. Does that kind of reassure you that we're at least looking at it?
Thank you for that, Chair. As I say, my concern as an elected member is the fact that with sitting on two services, I'm seeing targets not being met, and not being met by not just a little bit, but quite a large differential. And I think that should flag up serious concerns within the administration. And I look forward to, hopefully you're able to progress that. That's all I'm saying.
I'll do everything I can to do that, Andrew, and I'm sure Lillian will be raising that at senior leadership team, which is the right place to do it, because it's not councillor's job to do PDRs. It's a paid service. So I'm going to move on now. I think we've had our say on that one. Anybody else got any questions? No, I'm not seeing anybody, at least in the room or virtual room. So I'm going to move to recommendations. 2.1, review the 6-month summary of performance.
Chair.
Councillor Scobie?
Yeah, just on that, and to the question I asked in regards to respite, and the fact that the paragraph I've read from has a 12-month mapping out of family support activities. Could we have respite included in that, and that we get an early report as to how we're addressing the issue and trying to meet that?
Lillian saying she'll do it as part of the Children's Services update.
We'll add it, yeah.
You'll add it to it, okay? Are you okay with that, Willie? Yeah, thank you. So again, we'll just go recommendations. 2.1, are we happy to review? We've reviewed it. And in 2.2, and scrutinise. We've scrutinised it in some fair detail. So are we happy to agree the recommendations? Right, thank you very much. Gillian, thanks for your time. We'll move on now to item number 6, which is a home teams update. This is brought as a noting paper at the request of this committee. If some of you will remember, 4th October 22, we actually asked for this information to come forward. Barbara Aiken, hi Barbara, Barbara's online. Barbara, are you quite happy with your report? Is there anything you want to add, or you just want to get some questions?
I don't think there's anything I'd add, Andy. I don't know why it's taken so long to come to you, just based on what you said there. But we update on the home teams regularly through the Health and Social Care Partnership. So basically, this is the most recent update that covers everything. So I'm thinking it's quite comprehensive. So I'm happy to take any questions that anybody may have.
Okay, thanks, no problem. I'm going straight to questions then. We'll ask our IGB rep, Willie, and you come.
Aye, Chair, I don't know if it's a hindrance or an advantage. I'm looking at this, and we had the opportunity as IGB members to actually meet with Lillian that I found very constructive. But what it did do is look at the delayed discharge and reasons for those delayed discharge. And I know that Andy McFarlane's pursuing that issue in terms of reasons and so forth. But I'm looking at page 56, Barbara, and can I say I met with the manager of the home team, I think it was on Tuesday, so it was quite interesting. But it's really looking at this where it refers to on page 56, potentially the initial focus of D2A, whatever D2A means, process will be within medical assessment unit, thereafter roll out to other hospitals and wards. And I'm looking at this in terms of the motion that this council endorsed unanimously in terms of our cottage hospitals, notwithstanding some are still open for clinical use, but we've got some that are closed for that purpose. And whether we are looking at this in terms of that motion and the use of our cottage hospitals.
Mm-hmm. Just to be, do you want me to answer that, Lillian? I'm not terribly sure.
Yeah, I'll just do an overview at Barbara, and then be happy.
That's fine.
Councillor Scobie, this is around the home team, so I'm just want to be just for Barbara. What is your, just to make sure that we answer your question? Delayed discharges in cottage hospital. That's a different scenario. That's for IGB to deal with, but this is just to give you an update on where we're at with the home teams and the functioning of the home teams, and I'm sure Barbara could give you a bit more on that, just so that we're clear on what you're asking. Thank you.
If I can clarify,
that's fine. Thanks. So
hang on, Barbara, and Councillor Scobie will clarify what is required.
Sorry,
that's okay.
No problem.
A
wee bit difficult when you're on Teams, folks. Forgive me for interrupting.
No, that's fine. Councillor Scobie, if you could clarify, that would be helpful.
I'll clarify for Barbara if I can. It's when the home teams are looking, they're looking at delayed discharge, they're looking at where we can place people to try and get them away from hospitals and staying a day longer than they actually should, and whether indeed we have got the facility given the motion that we passed in this council. Always find it difficult in terms of our relationship as social workers to IGB and whether we do have an input, but nevertheless it's just that the cottage hospital is part of that toolkit that we are using that or making the point that we would like to be available to utilise to the full on the ones that are closed.
Okay. No, so what I'll say, so you first said, Councillor Scobie, what's D2A? That was our abbreviation of discharge to assess. So that's what that means, basically. So discharge to assess is one of the key pathways that home teams will have embedded within them. And basically, essentially, we're looking to discharge people home first and foremost. So that's to their own homes with a package, with a kind of wraparound support service that hands off to either either longer term care or reablement, whatever we can do for people that meets their needs and outcomes based. So that's that discharge to assess pathway. What they're doing at the minute is looking at the best use of cottage hospitals, and I'm aware that there's a consultation process going on round about that. That's probably the best answer that I can give. But where appropriate, cottage hospitals may have a role in that, but that's not determined or clear just at this point. So that's probably the best answer I can give you at the moment, if that helps.
Yeah, I think just to add as well, and it's not in our remit to actually, that's very much an NHS remit. So and an IGB issue. The whole purpose of this report was to tell us what the social work team's input was towards home teams, not what we think might improve it. That's a different consultation, and I'm sure Willie will get into that consultation process through a different route. So I've now got, let me see, Andy Wood and then Pauline Drysdale.
Thank you, Chair. Once again, interesting report. In 3.2, I would like to get clarification on the second sentence where it goes, consideration is required as to when the transition will take place. Can you elaborate on what is being considered there? And furthermore, the word consideration is used again in 3.3, where it's talking about consideration is required as to how social work will manage their referrals through MORS. Once again, can you elaborate as to just what has been considered to take you to your final conclusion?
Yeah. Are you happy for me to answer that, Lillian? Yeah. So in terms of that relates to the IT function roundabout home teams, Andrew, which is quite complex because you're bringing together, I guess you'll understand, two currently separate IT systems that run across the NHS and social work, and what home teams need to do is bring those both together so that all of the information channels in through one particular source. So what I can advise you is there's lots of work, some of it quite complex, going on with our IT colleagues to bring that together to ensure that we've got this one safe way of looking at referrals, making decisions and sharing information. So at the minute, we're looking at Mosaic is not going away. That's our information system. What we need to make sure is that when those referrals eventually come into MORS, that there's a robust and safe link in to Mosaic that kind of enables social work staff to follow through the next part of the process. If, for example, if someone requires a care package, it needs to go through that process to enable it to be paid. So at the minute, all of that work is ongoing, and I think there are developments being made. There will be a workaround to start off with that links MORS up to Mosaic, but eventually over the next 3 months we want to get to the point where social work colleagues as well as NHS colleagues that sit within those home teams are trained in and actively using MORS, and it links robustly to Mosaic. So that's probably the best way I have of explaining that at the moment.
Can I say through yourself, Chair, I think Barbara's done an excellent job at putting it in layman's terms for, an elected member like myself. I would also like to raise another point as well, which is on page 56, where in the chart it's talking about the tabletop exercise being planned for the end of January. And then it says to manipulate the data. Maybe that's not the right word. It should be used there. I'm not sure. How would you determine manipulate?
Yeah, maybe manipulate. I totally take your point. Maybe the word manipulate is probably slightly deceiving, isn't it? So what we need to do, Andrew, is start somewhere for the discharge to assess process, and what we will focus on, it's really difficult to kind of, for example, when you think about the acute hospital DGRI, to kind of work out where we best, I guess, focus our attentions in terms of beginning to work where people appropriately through that discharge safely to their own home and then that ongoing assessment. So what we're going to start doing is looking at the people coming in through the medical assessment unit. So they're people that are potentially have kind of lower levels of needs where they get that quick assessment at the front door, flag those people up get our service known, get our eyes on those people at the earliest opportunity, assess that it's safe for them to go home with a level of support, and start kind of picking a cohort of people really to test those processes out within the home teams. So we're kind of looking at those figures and those numbers and the pattern of those people at the minute, so as we can start moving that cohort forward. So maybe we'd better just think take that word manipulate out. That probably wasn't the best use there, but I hope I've explained that to you.
No, through yourself, Chair, once again, excellent, Barbara. I do really appreciate the information, additional information you're giving us. Very helpful. Thank you.
Okay, thanks very much. Pauline and then Linda.
Thanks very much, Chair. Barbara, thanks for the report. And also thanks for the time afforded to me a few weeks ago, because my understanding is that the Stewartry was the first place that the home teams were rolled out. So I suppose I'm coming in on the back of the other two councillors to say I was a wee bit alarmed to see that the Morse and the Mosaic hadn't been implemented yet. So at the moment, are you just using different systems so that social work can work as effectively as possible? Because on the last page of the report, it says that it won't actually be implemented till the end of March. So it was just to check it's all going to be a smooth transition, which of course I understand is never easy. No. But, what I don't understand, and I'm going to be quite frank, is how it could have been working in the Stewartry, because everyone that needs an in-home care package has to have a social worker to head that up. So I take it it's just been done by phone or email at the moment. If you could just confirm that, Barbara. Thank you.
We've had to find a workaround, Pauline, which has worked. Do you know, it's just that it's not the most streamlined and efficient way of doing it. What you want is us all to be able to use the one system, and we really are getting there. It's just it's taken some time, because it's two completely different systems that you're having to bring together. So the workaround's been robust and safe. It's just not the way we want to do it long term. And honestly, there is all sorts of work going on round about bringing these two together. So, and some of it's too complex for me to tell you about, Pauline. It's sitting with these IT people, but they're working on it.
All right. Thank you for that. Thanks, Chair.
Linda.
Thanks, Chair. Hi, Barbara. Thanks for your report.
Hi, dear.
Really, really good. Couple of questions. Great initiative. Really hard to get this going, so I appreciate that. It doesn't get away from the fact that in terms of workforce planning strategically, we're under-resourced. And I think that's a key issue, which is one of the reasons we're having to move to this model, which is really unfortunate. And that's a lack of strategic workforce planning, I would suggest, Scotland-wide. But the main question from me today is in the appendix, the second paragraph, the last sentence says social work colleagues will join our home teams by the end of March 2023 due to an internal restructure across adult social work services, which is fine. What effect will that have on other areas? Can you answer that one for me? Thank you.
Do you, when you say, just for clarity, Linda, do you mean other areas that social work services currently provide? So the other parts of our service, yes. Is that what you're getting at?
Indeed.
So adult support and protection and learning disabilities and all the rest of it. So yeah, the adult social work restructure is underway. We were given additional staffing through multidisciplinary funding that became available through the partnership. So there are additional social work staff in home teams. So we have done a huge exercise in kind of trying to analyse and work out what staff that we need equitably across the other three areas. So there should not be a negative impact when home teams are fully up and running across those other areas, if that helps.
Yes, it does, Barbara. Thank you.
I think Lillian wants to come in as well, Linda.
Thanks, Councillor Dorwood. Really important question. I mean, one of the things that we're working on just now is making sure that all services within social work remain integrated as much as they can with the local authority, because obviously we continue to hold the professional development and oversight for social workers. So Barbara is undoubtedly, as a senior manager for adult services, the link between the local authority and the partnership, and we'll work to make sure that this doesn't have an impact on the wider social work services. Thank you.
Okay, Linda.
Yeah, thanks, Chair. Thanks, Lillian. That is the concern, obviously. But thanks for the assurance. Cheers.
Thank you. No problem. Anybody else? I'm not seeing anybody else in the either in the room or virtual room. So what the recommendations, we're just asked to note the update on home teams as detailed in the paper. Are we happy with that? Okay, thanks very much. Barbara, thanks very much for your time this morning, and nice to see you again. Okay.
Thank you. Nice to see you.
Bye.
Bye-bye.
Okay, so we'll now move on to item number 7, the significant local and national resource pressures for fostering and residential services. It would have been Stephen, but obviously, as you've heard, he's not available, so I've got Sheila Clingan here to lead in this today. Yeah. Sheila, have you anything you want to add to this, or are you just quite happy to go to questions?
I think there's actually been earlier discussion today which highlights some of the increasing demand in fostering and residential and the shortage, so I'm quite happy to go to questions.
Thanks very much. So I'm going to throw up the questions now then. Andy Mack.
Yeah, thank you, Chair. Point 310 on page 58 talks about the demand on foster places and the fact that we have English local authorities who are looking to place children in our area. Does that work on a one-to-one basis? Or do we have similarly the opportunity to place children from locally into local authority areas in England where perhaps that would suit their needs better? Thanks.
We do have that opportunity. However, what we do need to acknowledge is that there is a different educational system in England compared to Scotland, and therefore it depends on the age and stage of the child. What I would also say is that there's also English local authorities are looking in Scotland because they can't find the resources in England, so they're coming south, they're coming north of the border. There are some occasions when we would look south of the border, particularly for children who live in Gretna, Langham, and that would reduce the travelling arrangements. So in short, the answer is yes, we can, but on the whole, we tend not to. We tend to try and limit our search to Scotland if at all possible.
Yeah, thank you for that. I have experience of children who moved around the country in my previous roles, and I'm aware of the challenges that brings. But it just seems that clearly there will be more foster places available within the English local authorities than there are in Scotland. And it seems that where we have a shortage, we should really look to minimise that if we have any sort of control over it, I think. Thanks.
I think I would just make the point that there's a perception that there's more foster placements available in England. They're not necessarily, as Lillian alluded to earlier. We have a number of situations where along with other local authorities, could be competing for a place, whether that be in Scotland or England at this moment in time.
John Young.
Thanks, Chair. I'm particularly interested in residential facilities. I know in our ward in Castle Douglas and Crocketford we've got the Dunmuir Park facility, but I personally don't know the capacity of that facility. I don't know who runs it. I don't know if it's council owned or managed by a third party. I would find it very useful, if possible, to have a sort of detailed list of all the residential facilities throughout the Dumfries and Galloway and the capacity of them and who the residents are and how they're managed. I don't know if that would be possible, but I personally would find that very useful.
Thanks, Councillor Young. If I can come in and just answer both those questions for you. Dunmuir Park is run by the Health and Social Care Partnership, and it has 6 units for adults, so it's an adult facility. We only have one children's home, one children's house in Dumfries and Galloway that's capacity for 5 children. We could get you a list of the provision within the region that's external provision. However, that changes quite rapidly, but we could get an overview of how many units that are run within the unit, how many beds that facilitates to, that will have nothing to do with us in terms of the management or the organisation of those units, and it will rarely have our children placed within them, but I can certainly get that for you. But Dunmuir Park is an adult facility. Thank you.
Okay, John.
That's very useful. Thank you, and I appreciate that.
Okay, no problem. Lynn?
Hi there, Chair. I'm referring to page 57 on 3.4. Obviously, it's very evident there's just the one children's house currently in Dumfries, and I was just wondering if the council are looking to maybe get another children's house in obviously the east or the west of the region. That was my question. Thank you.
At this moment in time, our children's house in Dumfries is full, and we're managing that with the number of referrals that come in and children moving on to alternative placements or longer term placements. We're currently constantly reviewing our figures and constantly reviewing the demands for residential childcare. We have an exceptionally large number of external providers across Dumfries and Galloway that we can use if we wish to use, and I think at this moment in time we are not looking to develop a further children's house at this moment in time, because of the local provision that we have or have access to is significant within Dumfries and Galloway.
Okay, thanks for answering that. Thanks very much.
Okay, anybody else? Andy Mark, back in.
Yeah, thank you. It's just a follow-up. I've been listening to what you said there, and just to follow up on my original question. When we have children from external authorities, wherever they come from, who has responsibility for those?
It is the placing local authority who places them within Dumfries and Galloway. We do not have that responsibility for those young people. It remains with the local authority who place them in the units.
Yeah, I'd just also like to add to that from Sheila. I mean, sometimes we don't even know the youngsters that are in the region until perhaps there is an issue. So it remains the host authority, although if there is an issue, we can sometimes be required to get involved. Thank you.
Yeah, thank you for that. How effective is that? Because, as I say, my previous experience is that once a child is placed out of authority, whilst it remains their responsibility, actually getting them to accept that responsibility and act on it can sometimes be challenging.
There is legislation in place. They are fully responsible for those young people. Therefore, they have to meet their needs. All of those young people would be looked after children responsible to that host authority, so they can't abdicate that responsibility. At that point, if there are challenges or they're perhaps not being as vigilant, then there are occasions when we may get involved. But on the whole, we do not get involved, and they manage that in accordance to the contractual arrangement that the host authority has with the external provider who's based within Dumfries and Galloway.
Can I ask a supplementary? I appreciate this is a report primarily aimed at children, yeah, but we will get some into the transition stage. So when we've got youngsters for 16, 17, 18 who could be in care here, who've got and end up, I think the term used to be ordinary place of residence, do they then become our responsibility? Have you any idea how many we've got in that kind of position, Sheila?
What I would say is most of those young people, and they would tend to be 18 plus, they wouldn't tend to be between 16 and 18, they would primarily remain within their placement or return to the local authority. Many of these young people wish to return to their placing local authority because that's where their family and their friends are. What I would say is that there are a few young people who may have been resident within Dumfries and Galloway for a number of years, and the external provider will help support them to make that transition. The leaving care responsibility for those young people still sits with the host local authority, and they're responsible for them in accordance to their through care and aftercare up to the age of 26. So if they wish any involvement from Dumfries and Galloway social worker, young persons transitions team, then that would be by negotiation. It's not an assumption and it's not an automatic right. However, they do have the right to apply for housing in their own right in due course. So once they do that and then they are housed within our local authority, then they can become ordinary residents.
Yeah, the only reason I asked you because a personal experience of we had that very similar situation in a very well-meaning organisation. We had people for a significant period of time who became our responsibility, and I think we had to actually dip into reserves to initially until we could mainstream the budget for that. But that's a long time ago now. I just wouldn't like to see that happen again. So just, I'm heartened by your response there, Sheila, so thank you. Is there any more questions? I see there's somebody got a hand up again. David, is it you?
Yes, it's just a question of another authority placing children or young adults here, and this authority knows nothing about it. Is that what's being said here?
That can sometimes happen, yes.
You need the mic on, David.
Is it not good for both authorities to know exactly where they are and who the people are? Or is it not better rather than find out later on?
There is a responsibility for them to tell us, but they don't always follow that responsibility. Thank you.
Right. Could it be possible to maybe ask them to?
We only know when there's an issue, and when there is an issue, we then raise it through Care Inspectorate and the host authority at that time.
Okay, David? Yep. Anybody else? No. In that case, then, we'll move to the recommendations. We're asked to note the increased demand for fostering and residential care placements across the region. 2.2, the national shortage of foster carers and availability in residential facilities across Scotland. And 2.3, the service risk in supporting children and young people in the community to continue to live with birth family and extended family members and trying to identify the secure alternative care placements to meet their needs due to their home circumstances or behaviour being deemed challenging at times unsafe. You happy to note? Thank you very much. Sheila, thanks for that. We're on to item number 8, which is the implementation update for fostering fee. Again, Sheila, you'll be leading on this. The report's there for members. Have you anything you want to add? Sheila, are you quite happy going to questions?
The only thing I would say is that it was implemented on the 1st of April 2022. It has been well received by our foster carers, and it has certainly helped us as a service in relation to our future recruitment and retention of our existing foster carers. Happy to take questions.
Thank you. Any questions? Somebody's got a hand up. Is that still David, is it? David, is that a legacy hand? Right, no problem. I've not seen anybody online. Looking in the room here. Just to give people a second or two to come in. Paula, in you come.
Yeah, just a comment. Thank you, Chair. Just, I'm really pleased to see that this has done what we were hoping it would do. I know I've raised it before in social work about what we were doing to recruit more foster families, so it's really, really good to see. I also noted that there was an individual who has applied for foster care, which is really good to see. That's absolutely fantastic. So just well done. Thank you.
Okay, thank you very much for that kind words, Paula. I'm not seeing anybody else. I think it's time we'll just move on to the recommendations. So are we happy to note 2.1 to 2.3? Okay, noted. Thank you very much. We'll move on to agenda item number 9, continuing care. And again, Sheila will be leading on this. Is there anything you want to add, Sheila?
The only thing I would add to this is that this is now a legislative requirement on behalf of Children and Family Social Work that children have a right to remain in their care placement up to the age of 21. We are currently undertaking a registration of our continuing care service with the Care Inspectorate, and once that service is up and running, we will be able to take forward some requests for continuing care. At this moment in time, we don't have any continuing care young people because they're supported through our supported lodging service. The only other point that I would make is, while this is a legislative requirement on behalf of social work services, there is no financial package from the Scottish Government to support this moving forward. Happy to take questions.
Okay, thanks very much. Tracy?
Thanks, Chair. It was just to say, is there a possibility that we could have perhaps detailed information on the council obligations as corporate parents regarding looked after children? I think this would be beneficial, especially for new members.
Lillian, yeah.
Thanks, Councillor Little. Certainly happy to do that, either in the form of a written briefing or a seminar. Happy to look at that and come back to members with a proposal. Thank you.
Okay, would we prefer written briefing or a 20-minute introduction like before committee sometime? I'm in your hands, or whichever way you think would be best.
Can I come in?
Somebody's want to come in, yeah. Come in, Chrissy, yeah.
Yeah, thanks, Chair. Personally, I think the seminars are really good. Sometimes I feel that, you know, the spoken word is better than a written word, and I think, you know, the social workers can get the point across better for me. Don't know how everybody else feels, but the seminar would be great, Lillian. Thank you.
Okay, so that's one vote for a seminar, I think is what you said, wasn't it? Yeah.
Yes.
2 votes for a seminar, 3 votes for a seminar. Oh, this is like 4 votes for a seminar. We're getting there. Somebody wanting to come in. Lynn, are you wanting back in?
No, it was just to vote for the seminar. Sorry. Yeah. Not to vote for the seminar, but to say yes, it would be a good idea. Thank you.
I think we've enough votes. It's no bargain hunt. We're not going to argue about it. So, right. Okay, then. So we'll do that with a seminar. What have we got planned for the next one, Lillian? Have you anything?
Yeah.
Marian's hunting frantically through her computer just now. Give us 2 seconds.
We can rearrange it, but we did have something.
All right, it's care homes and National Care Service. I'm actually wondering, would we know in 3 months' time what it would be?
We could change it around. We could do the corporate parent one for the next seminar.
Yeah. Given the time, I know the consultation for the care home, it might be better putting it back to the one that we can change it around and have a seminar at 10 o'clock. Well, I'm assuming half an hour before the next social work committee meeting. And okay, Marion, can we programme that in? Yeah, thank you. So that keeps everybody happy. So, is there any more? Is it Linda? Do you want to speak now?
Thanks, Chair.
Do you want in, Linda?
Sorry about that. Apologies, I managed to cut myself off. It just a bit something that was maybe added in there. Sheila, thanks for the report, but something that concerned me, sort of thinking about it, you're saying that it's a legislative requirement, which is fantastic. The promise is a great thing going forward. It's very aspirational, and it's as it should be, meeting the needs of individuals in care until they're 21 or after that. There's no additional funding. Do we have any idea how we're going to manage that in terms of making that happen? Because I think there's a general consensus that we should do this, and we have to do it, legislatively required, but how are we going to fund that issue? Thank you.
We are currently funding it already for 10 young people because they're supported through our supported lodging scheme and service up to the age of 21. So in some ways we do have some provision in place at the moment. However, this is a new legislative requirement that will be open to a greater and an increased number of children, because it will actually include young people in kinship care, not those with a kinship care order / residence order, but those who are in kinship care beyond 16. And I did say in the report that I would like to bring a further report to committee outlining what the future implications will be for this as a service as we move forward, with a number of projections as to what those numbers will look like, both for kinship care, foster care and residential care moving forward for our looked after children population. So I would like to do that in a future report once we've had time to pull that information together for you.
Okay,
Yeah, thanks, Sheila, for that. Councillor Dorwood, could I also say that there is a proposal that there would be £500 million made available for children's services executive groups within local authorities for the promise. At this moment in time, there has been an allocation of 32 million from Scottish Government, and we're still awaiting the outcome of when potentially there may or may not be other funding made available to the Children's Services Executive Group. Thank you.
You okay with that, Linda?
Thank you, Lillian. Sheila, thank you, Chair. I think it's important that whilst we remain aspirational in terms of doing this, I totally agree with the direction of travel. I think we need to focus very clearly on who's providing the funding for it and lobbying to make sure that we get it, especially in the current financial climate we find ourselves in. Thank you so much.
Well, absolutely. And the only question I was going to have in this is, do you think we can have all this ready by June, or do you think it might need to be a later paper than that? I'm just thinking it's a bit unreasonable, given it's a totally changing landscape right now, and to commit us to June might have to come back later. I'd rather give you the extra 3 months over the period and maybe come back in the early autumn if members were happy to that, to amend the June to autumn 23. That just, I don't think there's much point in bringing a paper here that might potentially it might not be as full as it possibly could be. You want to come back in?
I think it would be really helpful if we could bring a paper back in autumn, because by that time the registration approval should have been through the Care Inspectorate registration process. So that will assist us going forward, because then we will then be a fully functioning continuing care service. So it would be helpful if it could be then.
Personally, I think that has to be the best possible route to go here, because we should get the maximum information that's available to us, and how it's working, how it's not working, right? You know, warts and all. Unless we get that, we can't really help you to achieve your targets. So are we? I'm just looking to see if there's anybody else wants to come in. I don't think so. So that's we had Matt Tuppensworth. So I'm going to move to recommendations now. So 2.1 is to note the rights as set out at 3.2 to 3.7, and then 2.2 agree to receive a further detailed report in autumn 23 rather than June on the rollout of the continued care legislation as detailed in paragraphs 3.3 up to 3.13. Just before we kind of agree that, so this will be the primary legislation that we're talking about, so there'll be statutory instruments coming in the back of it telling us what we need to do, am I right? Yeah. So that makes it all the better reason for actually waiting for a couple of months and getting a real update on exactly what our implications for ourselves and for the service and for the kids, to be honest. So we're happy to agree that with that amendment to autumn 23? Yep. Okay. Thank you very much, everybody. Thanks very much again. Thanks, Sheila. You're staying there, are you? Item number 10, the transformation programme, early and effective intervention and family support. Again, Sarah McGarva's got to be leading on this. Sheila, I take it you'll be not today with you this time, right? Absolutely not guilty. So Sarah, it's your report here. Is there anything you want to add to it? Are you ready to go to questions?
Not really anything to add, just appreciate the support that we received to get this service established, and the success that means that's now embedded within our services. So and our staff have now got permanent contracts, so that is good. So just questions now, yeah.
Okay, thanks. So you're ready to go to questions. Just one before we start. Is this the culmination of the investment over the last 3 years? Yeah, that this council's put into this service. Yeah.
Thanks, Councillor Ferguson. Yeah, it's the investment that members made in terms of a spend to save, and we have now fully embedded that into our core social work budget. Thank you.
That's absolutely brilliant. It's exactly what the intention was, and I'm delighted to see it's actually come to fruition. So, Willie?
Yeah, Chair, and just to what you say there, I think early intervention is important, and this report highlights that. And it's not so much the savings, it's the avoidance of how much it would cost in kids who would end up in the system, as highlighted in 3.6 and 3.7. And it's really for social workers and others to have the toolkit available. I referred earlier to respite. And I've had experience of one kid who may be low in number, but still that kid going into foster care at, again, a cost as is highlighted here. So it's really that we do everything that we can in terms of the early intervention, that we have as much in the toolkit as possible, so that, you know, we can fulfil that work and keep kids out of the formal setting or the system. So it's really just a congratulate and well done to all in the early intervention, and this highlights just how much it can save keeping kids at home in a homely setting with that early intervention. But we need to concentrate, in my opinion, more resources to it.
Thanks, Willie. I think that was a thank you, I think, wasn't it? Yeah, yes, absolutely. Yeah. Anybody else? I mean, this is an absolute good news story, you know, and I think it's something that we need to make people aware of on a wider, in a different format, a different style. We can take this forward. The only thing I would I see this. Yes, there's a cost saving, right, but it's the good practice that's in there, right, that creates the cost saving, right. So we've got it the right way around. We've no changed the service to save money. We've changed the service to give a better service, and in the meantime, that's allowed us to save money in the long term. But for me, the overriding thing here is that whoever's benefiting from this, they benefit, right. That's the bit for me. I don't know if anybody else wants to come in.
John Young.
John Young.
Thanks, Chair. This really is an excellent report. My goodness, the figures are quite staggering. I'm probably being a bit silly here, but I'm just wondering if early intervention could apply to other social work services, such as home care. I wonder if there's a way for families to refer concerns early, and then before a crisis happens, assessments take place and somehow stop these crises and costs from happening. But no, an absolutely excellent paper.
Thanks. Yeah, okay. Thanks, Chair. Thanks, Councillor Young. I mean, we are looking at every aspect of social work service delivery, and obviously, as well as the development of the service, which thank you, members, for your support and your thanks around that one. We've also done some work around the development of the single access point, which does do that earlier screening process. So we have got different aspects of work within the service that we're looking to try and have that earlier intervention. Care at home is a more difficult concept, because generally by the time the referral comes in, then folks are needing that service. But in terms of adult services and justice services, we are looking at an earlier contact opportunity. Thank you, Councillor Young.
Could be a budget line for you, John. There you go. Anybody else? I've not seen anybody. I see we're getting some very positive stuff coming back online as well. I don't think anybody's got anything negative to say about this. And I'm kind of looking now, I don't think there's any other speakers. The only thing I'm minded here maybe is to put an extra recommendation in, just to congratulate the team on the outcomes that's been achieved here over the and actually shows if you do spend to save, it really does make a big difference. So that paves the way, of course, for budget leads, George, to look at it positively. Okay, so is there anybody else wants to come in? No. In that case, then we'll go to the recommendations. 2.1, we're going to note the progress and achievements of the Family Support Service over the past 3 months, as outlined in paragraphs 3.6 to 3.8. Note the focus of our collaborative audit undertaken through 22, as outlined in 3.11. 2.3, to give consideration to the long-term modelling of the Family Support Service, noted in paragraph 3.2. And I'm adding a 2.4 in there to congratulate the service for their innovative approach. It's of immense benefit to the people in Dumfries and Galloway. What's that effect? You comfortable with that? Right. Okay, and just finally, we've agreed all that. Lillian, if we can put something back to the staff team involved, to thank you for this committee. I think the comments are getting flagged up here today merit that. So,
we'll do that.
Yeah, thank you very much.
Thank you, members.
Thank you very much, Sarah, for that. And thanks for your time. Now, we've now moved on to item 11, which is the minutes of the Public Protection Committee and for noting. You happy to note? Okay. Thank you very much. That
Chair.
Sorry, yeah.
Sorry, I put
Andrew,
my hand up. I haven't got into the chat yet. Sorry about that. It was to highlight within that particular report. I note that none of the administration were actually available at it. They put in their apologies. But on 9, where they're talking about the financial harm strategy proposal, quite concerning to note that fraud's very much on the increase. And is there anything else that we can do to, I know there's going to be a further review on it, but is there anything else that we as a council can do to support and assist?
Yeah, Lillian, yeah.
Thanks, Councillor Wood. As one of the Vice Chairs of the Public Protection Committee, I can confirm that this is an area that we're continuing to work with collectively as a multi-agency. We certainly have a number of strategies and a number of current interventions from all parts of the Public Protection Agency led by police. So I can't speak for the committee as a whole, given that I'm not the chair, but this is certainly an area that we're acutely aware of the increase in terms of fraud, particularly for our elder population, and we're working collectively to try and provide support around that. Thank you.
Can I ask for...
I'll come in with the answer to the second part of your question, or the first part. Andrew, just a second. Can I answer the first part of your question?
All right, sorry, yes, indeed.
Right, yeah, because you were asking why there was no administration. Well, just to correct you, it's actually council representatives, not administration, because full council appoints us.
Right.
Ian was in planning committee, I think, at that time, and I was at COSLA, and the only people that can go there are the nominated person and the rep. There's no sub, so we can't ask somebody else to go in our place. So that's why there was nobody there in the day. Plus, just to highlight, it's an oversight position we have on that partnership. It's not an operational one. Clearly, this is because it's chaired by the chief officers, an independent chair, and the lead officers, Lillian, Mark Kelly, the nurse director, and the superintendent of the police force, local police service. So this is very much it's just an oversight role for councillors. But have you another question?
Well, thank you very much for that clarification, because I have to confess that I was of the understanding there were substitutes, but if that's the case, then that is where we are. It was really just to try and get more detail about the sort of actions that Lillian was talking about that they're going to hopefully try and consider.
Councillor Wood, there's quite a lot of detail around the areas of work that you're seeking for clarity on the Public Protection website, and I can certainly happily send you that link. And if it would be helpful, I can ask the Public Protection Manager to have a discussion with you. Thank you.
Yeah, okay with that, Andy?
Yes, no, that sounds like a plan. Thank you.
Okay, that's fine. I think we just also should note it's a multidisciplinary meeting. It's not a council meeting per se, although we might do a lot of the spade work, for lack of better words. Anybody else got any questions on this? George?
Yeah, just to say, it's an important issue. Sorry, it's an important issue. The various community councils that I've attended, and also our police, fire, and emergency committee that's been asked a few times, but the feedback we get from the police on the ground and from the the superiors in the committee is that it's mostly out of the area. It's an international or national thing, so it's very difficult for the local police to actually get a handle on it and actually have an effect on it. But it is really serious, and Lillian's quite right. It's often the old people that are suffering, so it's certainly something we should be doing what we can in collaboration with other authorities, because it's a really sleeky way to hurt folk, and it really affects them mentally as well as financially.
Absolutely. I mean, I'm sure Lillian can pass that comment on to Hamish, the independent chair, because at the end of the day, he's appointed to run, control, manage, whatever you want to call it, that committee. That includes the agenda and everything else, but and some of the work streams. Yeah. Each of the constituent authorities can feed up into it, and then we should get back then a multi-agency approach back, which is the whole idea. It's why it's taken many years ago. It used to be a local authority function, and a lot of public inquiries came about, and that's the reason why it became multidisciplinary, so that everybody was around the same table. So, yeah, your point's well made, though, George. Anybody else? Somebody got a hand up again. Is that Andy? Is that Andrew Wood's hand still up? It's okay. Thanks, Andrew. Right, okay. So that's it. Have we noted the couple of comments, and Lillian will take back the feedback back through the system for the chair and the chair's actions. That means I've got no other business. No extraordinary business, nothing else to bring forward. So once again, thanks very much, everybody, and we'll see you
18th of April.
On the 18th of April. And that is the time we'll have at 10 o'clock. We'll have the corporate parenting introduction for new members and old members as well, because it's and then you get asked questions and a wee exam after it. Okay. Okay, so once again, everybody, thanks very much, and thanks for your civility in the way we've done business today. Thank you very much.